I'm thrilled to welcome you to Big Ideas Virtual Week Translational Health Day. We are fortunate to have with us today Brad Nations, who is the Vice President for Employer Solutions with Consumer Medical. Brad is also a proud Bobcat alum, graduated in 1996, right?
Yeah.
From the Department of Speech Communication at the time, which is now Communication Studies. And one of the good things about having Brad with us for our Translational Health Day is that it really helps us to showcase the variety of different majors and areas and topics that can ultimately lead to really, really interesting jobs in the health field. And so obviously the Translational Health Research Center at TXST is focused on all kinds of research that moves interesting evidence into the places where it can actually improve health. And Brad's company is doing that. So thank you so much for joining us.
I'm so glad to be here. Thanks.
So we'd like to get started today by just sort of finding out a little bit more about what you do and sort of your path that's led you to the company that you are in now and the position that you have now as well. And then I think more importantly, I would really like to hear a little bit about your views on the way the healthcare field has transformed.
Yeah, happy to. Probably like everybody else, I'm doing exactly what I thought I would do when I was in college, right? So, again, thanks for having me. I'm so glad to be back on campus. I got a chance to dust off my class ring, which is great. I haven't worn this in a long time. And just glad to be here. Yeah, so I graduated in 96, and just by way of quick background, the exact opposite of what I said is probably true. It's never a straight line, right? I never in my life thought would end up, in this field. I'm so thankful that I did. But I actually spent the early part of my career after graduation in operations, actually building and running call centers. So worked in banking, worked in insurance, worked in telecom, a lot of the time in the Dallas area, and really learned how to operationalize something like that. But luckily was able to use the communication training I received here at Texas State, because functionally call centers, that's all they are, right? It's just communication mechanism. And then in 2007, my life changed in a variety of ways. One, as I joined an organization based out in Silicon Valley, but really kind of headquartered in Salt Lake City, and moved my family out to Salt Lake to help build what ended up being kind of the first of its kind organization in the healthcare world. So they're called the Medicare Exchange. If you think about what ACA or the healthcare reform that Obamacare has brought with regards to plans and choice, we did something similar, but with Medicare. And that was really my initial foray into the healthcare space, and was very, very fortunate to build something from scratch. So a true startup story, and sleeping in the office, a lot of terrible months and a few terrible years, but then we got it figured out. And in 2012, we were sold to a larger organization, and I stayed with them for several years. And then since then, I've really been working heavily in the digital health space. And then today, I work for an organization named Consumer Medical, which is awesome. I love what I do. We're one of the most mission-driven organizations you can imagine, and we basically wrap our arms around sick people and help them. So whether it's trying to make a decision about a surgery, a cancer diagnosis, my child is dealing with an illness or sickness, we provide second opinions, clinical education, we help identify physician quality. And I'll dive into a lot of that today. But I'm very fortunate in that what I get to do every day actually gets to help people. And to your earlier point, I'm not a doctor, I'm not a nurse, right? So I can actually function in this space, not being clinical, and I can actually have an impact on a lot of people's lives.
Excellent. Well, one of the things that I asked Brad to do was sort of share his ideas in a broader sense. And so we have a few slides that I think you'll share with us,
Sure.
Just to kind of talk through some of the things that we have talked about in anticipation of this interview.
Yeah, happy to. And again, thanks for the chance to go through this. I thought we kind of take it in a couple parts. So first and foremost, where have we been, which should be fairly familiar to everybody that's listening today as you kind of consumed healthcare throughout your life. And then some of the changes that have happened, and then kind of where we're going. And some of the things we'll talk about today might be familiar to folks, some might be revolutionary. In many cases, when we talk about this, people are like, oh my gosh, I didn't know that was available to me. And so I'm excited about that. And we'll also talk about some of the challenges and where we think things are going. So, but first and foremost, just by way of foundation, I'll start with a story. And actually a story about a fellow Bobcat, my wife. I've been given both permission from her, so I'm no longer violating HIPAA or any kind of marital rules, so I will not be in trouble. I was given specific permission. But I'll tell the story in two parts, because I think it helps kind of tell where we were and where we're going. And about 10 years ago, when we were living in Utah, she began to have problems with her eyes. She was seeing flashes and floaters. She would close her eyes and actually begin to see kind of weird images, and it was pretty concerning. So we did what you do. We went to the eye doctor, right? Her eyes were hurting. Her eyes were having problems. We went to the eye doctor. Eye doctor took a look, thought maybe her retinas were detaching, decided we had to do surgery immediately. We're scared. We do it, and we actually she had double eye surgery on the same day. So you can imagine the fear leading up to that, how awful that was, the recovery, the cost at a very pragmatic level. And after recovery, symptoms were still around. So as it turned out, the eye surgery was not really the challenge. And I'll come back to that later as to what it is that was the challenge, but I think it really illustrates how it is we consume healthcare normally, right? I don't feel well. I go to my doctor, and we just kind of historically blindly trusted that the advice we were given, the first opinion we were given, is always accurate because they're the doctor. Like, what do I know? And we never really took a step back to identify, is that doctor really trained for my specific condition? Is there a chance maybe that doctor hasn't had an opportunity to keep up with the most up-to-date evidence-based science for my treatment pathway? Were they in a hurry? They're probably an incredible doctor, but maybe they don't always have all the answers. Additionally, we fell into what a lot of Americans fall into, which is a lot of unexpected bills and costs, right? So we've all had that moment. You get a bill 6 months later, and you owe some doctor that you didn't even know looked at you or read a lab or report, you owe them $500, right? And I don't think it's any secret that the cost of healthcare has bankrupted a lot of Americans, and it put a real pressure on us as well. But seeking medical care has been pretty linear for a long time. You have insurance, you have a copay, you go to your doctor, and you just kind of follow that pathway, and it works a lot of the times. But some of the challenges that have popped up since then, a few things have changed. One is the way insurance operates. I think we can all agree we pay a lot more for insurance than we used to. And the burden is not only financial on us, we're also kind of left to our own devices a lot more, right? We don't have as much access to doctors as we used to. Have you ever been in a doctor's office and got their hand on the door trying to get to the next appointment? Well, one reason why that's happened is reimbursement rates for doctors have changed, right? So they have to see more patients to be able to generate enough money to run their practice. Many individual doctors' offices have been gobbled up by hospital systems and kind of put into bigger organizations. There's a lot of things that have changed for us as consumers of healthcare that have led to really us kind of being just on our own, right? And it's costing more, and we're having to make big decisions. We just don't a lot of times have the access to information that we'd like to have. And what that leads to are some pretty terrifying things. 5 to 10% of all diagnoses are misdiagnosed, right? So Patty's one of them. It's going to be 10 to 15%. Patty's one of them, right? She got a misdiagnosis. She went through double eye surgery because she was misdiagnosed. And a couple of interesting things, stat-wise, that always jump out at me is, you'll see a stat up there on the screen that says it could take up to 15 years for an advancement in a treatment to become common practice. So that means at practical level, let's say you're dealing with a cancer diagnosis and a new treatment has been developed, approved, it's clear as day, like this is the way you should treat this cancer. What that number suggests is it can take 15 years for doctors kind of everywhere to adopt that. So you could go through an entire treatment only to find out later that the evidence says there was a better way to go.
This is exactly what we're trying to address in the Translational Health Research Center, is to shorten that amount of time by making sure that evidence that comes from research and science moves into the clinics and the communities a lot faster.
Right. Yeah, and it's an interesting stat that I heard recently was there's up to 1 million pages of medical research published every year. Right, so you think about these doctors are incredible and truly some of the smartest, most dedicated people on the planet. It's impossible, right, for them to keep up with that, run a practice, and on top of that, how do you get down to the condition-specific level that is really unique to me or to my family when a doctor may be just dealing with more general things? And one other interesting part about how we've kind of evolved is think about how then you get to specialists. So you see your primary care and you say, my back hurts. And you might hear something like, oh, I went to med school with this great orthopedist, you should go see her. And you go there and maybe now you're in line for surgery because that's what orthopedic surgeons do, is they do surgeries. But how did you know that doctor, with the exception of being a great friend of your doctor, actually clinically has the right experience and outcomes for what you do? And we'll talk about how actually you can vet that now in a way that you never could before. And then lastly, and then we'll kind of get into some of the fun stuff in the future, is healthcare literacy. There's no question healthcare literacy around the world is at an unbelievably low level. And I shouldn't even say unbelievably, right? Because we're not clinicians, like we weren't trained for this. But people don't truly understand, their own bodies, their own health, and they don't have really great mechanisms to seek that information out.
Can you just sort of define healthcare literacy?
Yeah, great question. So it could be something as simple as I'm a diabetic and understanding what diabetes actually is and how it impacts me and what the consequences are if I don't seek appropriate care, right? Could be healthcare literacy. It could be my child has ADHD, right? What does that mean? And how do I best equip my child either through the educational system in my own home in order to really give them the best chance for success, right? So, and again, we're just not clinicians. I've got a speech communications degree from Texas State. I'm good at a lot of things, but I've got no ability to diagnose a disease or create a treatment pathway. And because of that, we tend to just kind of go along with what we're told in the 45 seconds we might get at that doctor's time, exaggeration. But so at the end of the day, what we're going to talk about here going forward is because the rules of the game have changed a lot, and because just healthcare has evolved and technology has evolved, consumers now actually have an unbelievable amount of tools available to them that they never had before. And so we'll talk about some of those today. I selected just kind of a handful. There's a lot going on the slides, so my apologies, but we'll just kind of talk through it today. But as you think about if I'm a consumer, if I'm home and I've got a diagnosis, something's not going well for me, there's now a world of options available. So let me highlight a few. First and foremost, I talked about access to doctors earlier and how that's becoming more and more challenging, right? How many of us, here in the room or even on the call today, had tried to go see a doctor? They're like, first available appointment is in 6 weeks, right? We've all had that phone call. Or you're not feeling well, or your child's not feeling well, and you have to pack up and go sit in an urgent care office or an ER, right? And there's costs associated with that, chance of getting sick again, and imagine COVID-19, right? Where we're truly trying to stay away from everybody. So some tools have been created over the last 10 years that have changed everything. The first is telemedicine, right? A lot of us are familiar with that now. That's not a terribly new technology, but I will tell you, utilization of telemedicine was actually fairly low until about 6 months ago. And then the craziest thing happened. we had a global pandemic, which really allowed people to access physicians either from their phone, audio or video, or from their computer, and actually be able to interact with the doctor without ever having to leave their home. And even away from COVID-19, think about the impact of that for a parent with a sick child, for someone who's not feeling well, or people that lack transportation options, right? We won't get too much into social determinants of health today, but that's a big part of our world, right? Are there fundamental access issues for me going to the doctor? Well, in many ways, telemedicine helps to solve for that. So you can actually talk to a doctor and they can actually send a prescription to your local pharmacy in many cases. So organizations like Teladoc, American Well, MD Live are companies that many of y'all may actually have seen as part of your benefit package to your employers, and they provide access to doctors and nurses remotely, which is a huge change. 20 years ago, that never existed.
Right. Yeah, I work in my own research with mothers who've just had babies.
Oh, yeah.
It's really challenging, period, because you're not getting any sleep. But imagine having a sick child and then having to pack them up and do something with your other kids to go to the doctor.
Yeah.
And then, maybe the doctor's distracted or busy or, their schedule changed and you have to come back again and again. And it can be a real nightmare. So telemedicine is sort of something that's been around, right? But now it's become sort of essential. I don't even know if it's an option anymore for a lot of people.
A lot of people it's not, you're right, especially with COVID in play. Now it's given a great access point and changed everything. And if you think telemedicine, a lot of times deal with more acute situations. And just by acute, I mean, I've got the flu, or I'm sick today, I've got the sniffles, something's wrong. What also has really evolved with regards to kind of remote access is what my company does, which is remote second opinions. So think less acute, like moment in time, more maybe I'm dealing with a chronic condition, maybe I've been given a diagnosis of some sort. So I've got a cardiac condition, God forbid, a cancer diagnosis. And so really the last 10, 15 years, you've seen the rise of remote second opinion companies. So I'll give you an example of what we do. We have built a network of doctors at places like Stanford, Harvard, Duke, City of Hope, Dana-Farber Cancer Institute, a wide variety of hospitals across every single subspecialty, over 2,000 subspecialties that you could possibly imagine. So no matter what your condition is, and no matter where you live, you can live in Odessa, Texas, and be dealing with a really unique autoimmune disorder. We can find a doctor at Harvard that has done the majority of the research and actually have them weigh in on your case. So an organization like ours will go out and we'll grab your medical records for you. We'll get all your labs and all your imaging, put that in a package and give that to the doctor. And a doctor from Harvard can literally weigh in and go, you know, Linda, I think here's what I see you're dealing with. Here's how I recommend you treat it. Here's what the science says the right way to deal with it today. And oh, by the way, if you don't have those treatment options in Odessa, we can help you find ways to get treatment maybe in Dallas, right, or a different part of town.
That's huge in Texas for rural medicine, especially when you only have one choice maybe in your town.
Yeah.
Not just to get a second opinion, but to get the best second opinion and have that access. That's awesome.
Absolutely, and it's changed people's lives in a great way. So I get to say every day I love my job and what I do. Again, as a speech comm major, I'm actually able, because I'm helping get this service out there, helping deliver that. And lastly, you know, just broad-based treatment decision support. That's a fancy way of saying, you know, you've been given a diagnosis, the doctor says, hey, I think you might have this condition. Well, when does the doctor ever hand you a nice clean booklet of information so you go home and read? So what do you go home and do? You Google it, right?
Exactly.
And if you Google long enough, every freckle is cancer. And, you know, it's terrifying and it's not always clinically accurate. So there's organizations whose whole job it is to curate materials to say specific to what you're dealing with, your child is, here's information on exactly what you're dealing with. And again, here's what the evidence says is the right way to treat it today, maybe versus the way your doctor learned 20 years ago. Yeah, so a number of organizations are out there just focusing on that, consumer medical being one of them. You know, we compete with great organizations like 2nd.MD, Grand Rounds, and others. A few other quick ones I'll hit on, kind of going more the micro level, and this is where it gets kind of fun, is really thinking about condition-specific programs. So, you know, way back when, you might have a doctor that's a generalist, right? So maybe they'll talk about your diabetes, they'll talk about obesity, they'll talk about whatever it may be. But now there's actually billions of dollars being poured into this industry as a whole, but even at the specific condition level. So entire companies like Livongo, who were built to deal with diabetes management, and they just took a step back and said, how can we fundamentally disrupt and change the way people manage their diabetes? And been wildly successful. They just sold for a ton of money to Teladoc, as a matter of fact. We'll talk about that. Other organizations like Virta Health, who's on the other side of diabetes, they say, you know what, for type 2 diabetes, we think you can actually reverse it. And we built an entire program about reversing type 2 diabetes. They developed apps, digital coaching, diets. And these people, all they do is wake up every single day and just think about how to reverse type 2 diabetes. Organizations like Hinge Health, I know those folks really, really well. A San Francisco-based company, they do the coolest thing. They focus on musculoskeletal, like joint problems. So imagine you've got a knee issue. Instead of going the traditional path with your doctor, you go to physical therapy, and again, maybe you have access issues, maybe there's costs associated. In COVID, going to a physical therapy facility is probably frowned upon. Hinge Health will actually mail you a pack. The pack has sensors. You put sensors on your legs. The sensors talk to a tablet that they also mail you. The tablet's preloaded with your exercises and your routines, and it's measuring your movement, making sure you're doing it correct. And then you've got a digital coach through the tablet as well to guide you through what you're up to every single day. So their clinical outcomes, people are having really good outcomes. It's less money, and they don't even have to leave their home.
Wow.
Yeah.
So they're creating tools that really empower you as a patient to really be part of your own care.
Yeah,
not
absolutely.
just show up.
Yeah, it's amazing. So think about how technology is playing a role. We all think about apps and things like that, but it's even down to the hardware that you strap to your body.
Wow.
And so there is information coming everywhere. Maternity and fertility challenges is one of the fastest growing areas. I have a great friend of mine that just started a new fertility company just to help young moms not only get pregnant, but then also dealing with issues that happen during pregnancy, through obesity, through there's a great organization in the Pac Northwest named Boulder Care that's dealing with opioid addiction through digital resources. So I digress on condition specific, but you get where I'm going is that really there's tools now across the entire spectrum of healthcare that are out there and available. And the last thing I want to mention before we kind of jump into a few other quick points on how data is being used is this idea of shopping. So if you think about how we operate today away from medical in our world, you're going to buy a TV, you're going to buy a car, maybe you just want to go out to dinner on Friday night with your husband, right? Rarely do we leave the house anymore without having done a lot of homework. Right? So even a restaurant, I'm going to go out to dinner with Patty. I live in San Antonio. I'm going to Yelp and identify who else thinks this restaurant's good or not. I'm going to buy a television set. I'm going to research like crazy. But we don't do that when it comes to our healthcare, right? We don't do that when it comes to an x-ray, right? No one thinks about the fact that doctor says I need to get an x-ray. What do? You go to the x-ray place the doctor told you about. Well, did you know that an X-ray is a commodity, just like imaging or CAT scans or labs? So you can actually shop for these services. And an X-ray at this facility over here might be $500. It might only be $200 over here. And if the image is the image, why don't you just go over here? And so there's tools that have been developed now to help people actually make decisions about shopping for their own healthcare services instead of just, again, maybe your doctor has a great relationship with this lab, but maybe they're more expensive. Even physician quality, which we'll talk about in a minute, you can actually shop the quality ratings of your doctors now. But the end goal here is because we're being now forced to really make bigger decisions and we own a bigger piece of the financial pie for our healthcare, we need to have tools to let us kind of manage that so we don't get those big surprise bills or we don't overpay for services. And there's an amazing group of organizations like Castlight Health, right? I used to work Grand Rounds, Vitals, even my organization, Consumer Medical's in that space as well. So lots of really incredible tools out there. I'll pause for a second and make sure I'm going too fast today.
No, I think these are all really interesting. I guess I was wondering, we kind of talk about how as a patient, you have the ability to take part in your own care, but what it sounds like you're saying is that it's now our responsibility. Because if these tools have been integrated into the care process, then there's an assumption that you're going to follow through with that me thing that they sent you. And, so my husband actually had an implant called a Zeo that measured his heart for 30 days, and he would put it in the envelope and send it back.
Right.
And then the doctor would call to talk about it, which is great, except for that put him in charge of managing that,
Right.
So there's a certain, I guess, responsibility that comes with that. Do you think that that's really being clarified for patients? And then the other question I had is, are these things being integrated? Because the way we access care is usually through some kind of a portal that is either Medicare or it's our insurance. Are they being integrated into the process of telling us what we're supposed to do?
Great question. The answer is kind of. And we're actually going to touch on that today. So we're going to talk about some of the challenges with all this incredible things, and aggregating those into single touch points is a huge, huge problem for sure. We'll touch on that. But I think to answer your first question, I don't know that we're going backwards, right? I mean, we are responsible for our health. We are going to have to take responsibility for that. And so the idea here is, the good news is there's a bunch of really amazing tools out there. The bad news is we're going to have to do it. And I don't see personally anything changing that really kind of alters that too much. But I do have a little light at the end of the tunnel we'll come back to when it comes to those in a moment.
Yeah, I think it is it's not that we have to do it. In a way, it's that we get to do it. Because we don't have to sit around and wait for doctors to tell us. We're not just a love to play. We are actively taking part in something that is probably the most important thing for our life, which is our health.
Yeah, it is the most important thing, right?
Yeah.
So I want to put a bow on Patty's story, and then we'll talk about some data, and then we'll get into some of the challenges, things that aren't going well. So back to my wife. So I told you the first part of the story, which is, she had unnecessary surgery, she was misdiagnosed, and still had the same problems she had to begin with. Well, this is long before I even knew a lot of this stuff existed. We just intuitively went out on our own and got a second opinion. And we found a different doctor. That doctor sent us to a neurologist. That neurologist did a scan, figured out she'd either had one large stroke or a lot of different strokes. He sent us to a cardiologist. And as it turns out, she had some large holes in her heart that they had to go in and patch. And that then stopped some of the unfiltered, dirtier blood getting to her brain that was causing the strokes. And so the good news at the end of the story is very positive. So she learned that away from her eye issues, which was just something that was presenting, her eyes were not the problem. Believe it or not, it was all the way back to her heart. And away from that, she had exercise intolerance, she had balance issues. Her grandmother and her mother had dealt with dementia and heart issues. All of those would have been long-term consequences. And now she's able to do yoga, she rides bikes with me, she can exercise again, and so she's kind of reclaimed. But if we had just simply had access to some of these tools initially, we could have avoided double eye surgery that was a complete waste of time and potentially puts her eyes at risk in the future. So, I think things like this can really help folks if they use it. We're going to talk about that in just a moment. A couple other things I want to talk about on the data side, and then we'll kind of really wind back to your specific questions. Data is being used obviously everywhere for everything. Some of it's terrifying in the real world, right? And we see a lot of evidence of that. Some of it's amazing. I'm going to try to focus on the amazing parts, but some things that have really evolved. And I say the last 10, 15 years, some of this is really the last 5, 6 years, and I've selected just a small handful of things, but the first is physician quality. So back to this idea that before I go out to dinner tonight, I'm going to check the quality ratings. And I'm going to look at Yelp, but I'm also probably looking at Google reviews and TripAdvisor. Might throw something out to some friends. They might have been to this restaurant. But again, back to the idea of the doctor. How do I choose doctors? Well, maybe I go to the provider directory and I find the one closest to my house, right? Maybe I select a doctor whose last name starts with an A because it's the first one I ran across, right? Or maybe I go onto Facebook and I say, hey, does anyone know a good pediatrician? Or I need an orthopedic surgeon. And again, the recommendations you get back, while helpful, remember, 90% of Americans lack healthcare literacy. Why am I qualified to tell you about a pediatrician that I think is a great one, other than, maybe my personal experiences? So there are actually now tools available to measure physician quality. And so let's say you need to have that low back surgery and you live in New Braunfels, Texas. You need to find an orthopedic surgeon who's actually done that surgery and had good outcomes. And we can tell you now who it is. You don't have to randomly choose a doctor at the provider directory. We can tell you. So imagine that you need a hip replacement and you want to find a doctor who's done a lot of hip replacements. So Dr. Smith has done 500 of these in her career. She's had great outcomes, low complication rates. We can see things like readmission rates at the hospital, infection rates, all that. So that doctor is going to be a fantastic doctor for your hip. But maybe 2 months from now, she wants to get into knee replacements. And she's about to do her second one, and boy, she hopes this one goes okay, right? She's not a great option for your knee, but for your hip, she's amazing. So you can actually drill down, and you're not in the business of saying good doctor, bad doctor. You're saying, is that doctor really qualified? Give me the best chance for success for my specific condition. These types of tools are now available to people, and you don't have to look at Google reviews or Yelp. You can actually see their clinical outcomes measuring their success, which is unbelievable, right? So, and doctors are like the rest of us, right? Amazing people, but they're all in bell curves, right? And so much of it is less about, again, good doctor, bad doctor, and more about just, do they have the right experience to deal with my condition?
But even the fact that that exists is going to make their care get better, because we all know if someone's watching or grading us, then we want to perform at a different level. And so to the extent that there might have been some slack in the system, I bet you as these ratings and physician quality tools become more prevalent, people will be very mindful of them.
Without question. So, and luckily, and this gets beyond my scope, the physicians themselves have a wide variety of new tools as well to help them, right? Because again, so many times it's not their fault, right? With all this data coming. A couple other quick ones. I've talked a lot about price transparency, so I won't retouch on that, but I think the idea is that people can actually go out and shop for commoditized services like x-rays, scans, things like that. Use those tools just in the palm of their hand. It's very, very helpful on that front. Predictive analytics is probably the fastest growing thing in our business. And that's a really fancy way of saying, let's look at all the data available and can we predict that you're on the road towards back surgery, right? And that look on your face is a good one, right? There's some big brothery kind of scary stuff out there, right? But the capabilities are really coming more and more online to say, we see that Mr. Johnson has gone to the doctor for his back hurts, a couple medications, some stretching, didn't fix it. Now he's in PT, a couple more medications. You can make a probability or you can make a projection that he may very well end up in surgery the next year. So would it help him if someone could reach out to him earlier and either try to do something to avoid the surgery altogether or make sure he's with the highest quality physician? And you can take it to the extremes. You could probably see you can see markers and claims data, like in medical data, to give a probability someone's got a cancer diagnosis, right? So again, it sounds terrifying. Like you don't want to get that call to say, Mrs. Smith, you have a 64% chance of having cancer in the next year. But at the same time, wouldn't Ms. Smith have liked to know that when she gets the diagnosis? And so we'll talk about some of the challenges, but this is a massive growth industry everywhere in our business and how data is being utilized to try to create better health outcomes. And so statisticians, actuaries, like people really kind of dig into this data is a big part of it. And lastly, just benefit matching real quick is just, what I mean by that is, I have a cardiac condition. How do I make sure that the right benefits part of my insurance plan is presented to me at the exact right moment? Maybe it's going to see a cardiologist. Maybe it's a program just to help me with my heart, right? So using technology to try to pop these things up and educate you at the right time is really a big key and something that's happening on a daily basis.
Nice. I know, when you think about prevention, we were talking about messages to try to motivate people.
Yeah.
What could be more motivating than getting data that says, this is your path.
Yep.
So let's, try to prevent this before it happens.
No doubt about it.
That's really exciting.
It is, but it also walks us right into one of our challenges, right? So we'll turn towards negative town for a quick second and talk about yes, while everything is, is amazing in growth and all of that, it's not all unicorns and rainbows here, right? There are some real challenges. So I thought I'd highlight some of those, and then we can kind of close out and talk about maybe where I feel like some things are going just from my perspective to try to improve. But so some of the challenges with all these things, first off, is just anytime you have massive growth like this, it creates a huge amount of opportunity, but also confusion. What you see on the left side of your screen is a small sampling of all the different solutions and companies that are out there. A huge volume of those companies did not exist even 5 years ago, 6 years ago. So I think I put on the last slide about 31 billion that's been invested since 2016. A lot of that money has gone into these types of organizations. Everything from the telemedicine we talked about, second opinions, digital resources, apps, you name it, it's out there. So imagine being an employer, right? So you're going to provide the benefits for your company. And every single one of these has about 20 different salespeople assigned to them. They're all trying to call you. They're all trying to get your attention. They all want you to provide this for your employees. It's very, very difficult, frankly, almost impossible for these employers and their consultants, anyone else, to figure out which one's right for me. And as I look at my population, I say, I seem to have a lot of diabetics. So maybe you're an employer in South Central Texas where diabetes is, really some of the highest anywhere in the world. So I want to find a diabetes program. Well, do I do Livongo? Do I do Virta? Do I do something my insurance company has? Will those work? Is it worth paying for? Measuring return on investment is hard, right? Just because it's the right thing to do doesn't mean you can afford to do it. And you said something really key, which is about communications. And so if I had to put one word on the largest challenge of all of healthcare, it's going to be engagement, or you could call it utilization. So people have access. Some folks are hearing me today going, boy, I really wish I had access to some of these tools. Spoiler alert, you probably do. If you actually go back and reopen your open enrollment guide, I'm like, oh my gosh, Brad's right, I have 4 of these things. But remembering that at a moment when you're terrified, right? You just had that diagnosis, you've just been told your child needs to have surgery. It gets to be very difficult. And so employers and who are the primary providers of insurance or private employers are having a difficult time getting their people to utilize these tools that are out there and available. And even away from the fact that we all often just don't make the best decisions for our own health. And so you have not only communication challenges, but something about our nature keeps us from taking actions. It's in our best interest in many cases. I talked about the diabetic, maybe it's not maintaining, or the cardiac patient. And so those challenges are real. So believe it or not, some of these incredible solutions I've told you are seeing less than 1% utilization across the population on a regular basis. So you think like, oh my gosh, why doesn't everyone get a second opinion? Why doesn't everyone research physician quality? Most people still are not using these tools. And that is the number one thing this whole industry is trying to solve for, is getting more people to use it.
So really it's access to these tools that is not just available out there somewhere, but it's actionable in terms of the moment you need it and the way that you need it.
Exactly.
So trying to harness all this and create, this is sort of like a giant card catalog of technology.
Yeah.
So with all of this, thinking about, obviously we've talked about how technology has caused some disruptive innovation to happen, but just like, I guess Christensen talks about, when he talks about disruptive innovation, he says, the technology is created long before it's needed. And people go, that's kind of like telemedicine. It was around and people were like, I like what I'm doing right now, until COVID.
That's right.
And it was like, thank goodness for telemedicine. And so these are all waiting out there, available for somebody to grab them and use them when they need them.
Yep.
And I find that really interesting, but I also was thinking about that in terms of our own students.
Mm-hmm.
So if these types of technologies are out there, they must have been created through research. They must have included people like, like psychologists and all kinds of technical kinds of jobs and all kinds of jobs that are not just physicians or clinical. How would our students begin to unwrap all of that to try to figure out career paths like you've done? Yeah,
no, it's awesome. And it's funny, when you and I had been talking about leading up to this moment today, you gave me a great stat, which really shocked me, that, and keep me honest, but you said there's 80 different degree programs at Texas State that in some form or fashion could touch healthcare, right?
Right.
And so, it really gets you thinking. So I think just your easy way to think is healthcare is like, I'm not going to go to medical school. I don't want to be a nurse, or maybe you do, but
we have a great nurse.
Then you should absolutely be a nurse, by all means. But maybe you want to impact healthcare, but that's just not your gift, right? I remember when I graduated from Texas State, my dad asked me what I was going to do, and I said, I just kind of threw out, I think I'll be a lawyer. And he called me and we had a long talk because he was a lawyer. And at the end of the conversation, I realized I don't want to be a lawyer. Like at the end of the day,
But it was a label that you knew.
it's something that I knew how to access it, right? Whether I had the grades to get to law school is a different story. No one looked that up. But you know, but your stat on there really got me thinking about people that I work with every day, right? And while my company that I work for happens to have nurses and doctors available, is I think for the last 10 plus years, it was primarily coders and app developers, actuaries, statisticians, the psychological part, marketers, right? How do you make something and get it in front of them at the exact right moment? Go back to app developers. I mean, think, how do you make the app so cool that people really want to use it? How do you make it easy to use, right? So I think the access point is wherever it is that your heart lies, A, and B, where your skill set lies. So I could never be a coder. I just don't have, my brain doesn't work like that. But there's a lot of folks out there who that's exactly how their brain works. If they have a passion for helping people, this industry, you can go do what you're best at, and you can write code that maybe can alert that cancer patient 6 months in advance that they want to start seeing this type of doctor to get ahead of it. So you can save lives from a dark room with their headphones on just by writing code. A marketer can absolutely save lives by creating the right messaging at the right time to get out in front of folks. You know, economics and finance is a huge part of our world. Like, how do you make these tools economically viable for the healthcare industry, but also for the people paying for them, which in many cases the employers or even the patients themselves. So I would say it's almost an endless list. Like we could have kept typing different ones. I tried to throw a couple that were standard up there that who I work with. But I do think, you know, I've seen a couple versions of this stat that healthcare represents about 20% of our economy. So if you think through that, for the students out there, it's not going anywhere. My eldest daughter is about to graduate with a supply chain management degree, and she's going to work for Premier Blue Cross in Seattle, right? And she's going to go out there and help them procure products that can be best served for their members to try to improve their health outcomes. Again, she's not a clinical person, but she understands product and product development, and that's what she's going to go do.
That's cool.
Yeah.
So it's the technology, so it's the app developer, but an app is only as good as the information that's in it.
Yep.
And so the science behind that happens in labs, but it also happens in, you know, social scientific kind of research and other kinds of preventive research where you're trying to figure out not just, you know, the coding itself that's really, really important to make the app really usable and really cool, but also what it actually does.
Yeah.
And so those two things together. Are there any tips that you could give somebody about how they might think about this? Like or, you know, how do I plug in? What could they look for? How could they begin that process?
Yeah, that's a great question. I mean, I think first and foremost, you know, like even just today, we've named a lot of really innovative organizations, and they're all hiring, by the way. Like if you go out there and look, so you know, there's a lot of places as you can plug in, and you can search for traditional careers like healthcare, et cetera. But I would encourage folks to try to, you can stay within your skill set. So if you're a coder, stay within that, but you might find that the company, you know, that's behind the curtain is actually in this particular space. I would do homework on, you know, these organizations. If you start looking even just on companies that are going public, companies getting acquired in the healthcare space, it's just a big mishmash of everything we've talked about here, these different organizations. So you can kind of see who's on the bleeding edge. Here's kind of an interesting thing you can look at too. You can very easily with a Google search, find out where the investors are putting their money, right? So if you learn about Series A funding, Series B funding, Series C, which for those of y'all that don't know what that is, it's just, I've got a great idea and Melinda's got a pile of money and I'm gonna talk her into giving me money to let me go build this thing. Well, that would be Series A funding, right? You gave me the initial seed money. Go find out who just got $10 million in Series A money. And that's a group that has an idea that someone thought it was good enough, they gave them $10 million. Or Series B funding means more money was given to them to go develop. And the cool thing about this business is it's a rocket ship in that they typically go fast. A lot of them are Silicon Valley based. And just as a side note, a lot of times if you get into these companies early, you can actually get equity and you can make some money yourself, right, to help kind of advance your own personal cause. But
right. So when you graduate with a degree in, say you graduate a degree in public health, it's instinctive to go look for public health jobs.
Right.
But really, you can be the expert in the room
Yeah.
who has expertise in public health that's working in this other type of company. You know, it could be a tech company or it could be a healthcare provider company or whatever, so that you actually have the ability to take the classes that you've learned information from and become an expert on something, and then move that into a slightly different arena to look for these types of opportunities.
I think it's great. And one other thing I'd add to that is just think about even non-traditional, like just regular companies day to day, because if you kind of follow where I was going with responsibilities at the member level now or the patient level, that also means that a lot of responsibilities at the employer level, because they're the ones providing the insurance. And so those types of degrees and that type of research ends up being really needed in just places like HEB, right? I work with HEB here locally. They have an incredible human resources team who I would argue is the most myopically focused group of people when it comes to like supporting their employees. But they have people who have masters in public health, and they have people who are trying to figure out how to serve. I mean, HEB has over 20, 30, 40,000 people, right? It's like a city, right? How do you provide services to them? So the strategy that you get to implement from what you learn here could actually help companies that have nothing to do with healthcare, but they all provide a lot of healthcare services. And even a group like HEB, actually, they have their own clinics. They actually have their own doctor's offices there on site. So.
Right, so research to figure out where you can plug in as an employee, but also it sounds like employers need a lot of help to navigate all of this. So there's opportunity to think about business kinds of tools and products and services as well.
Yeah, and there's consulting firms in between the two, right? So there's millions and billions of dollars out there for consulting houses trying to help companies. How does Dell make a decision for the type of benefits they're going to provide? Well, they hire a company named Towers Watson, and Towers Watson helps them kind of sort that out. So the access point is probably endless. And I'd be more than happy to volunteer myself. If anyone's out there that would like to, like at an individual level, talk through it, I'd love to visit with them.
Awesome.
So,
well, I find all of this really exciting and a little bit scary. If you could just sort of, look into the future, get a crystal ball, in 10 years, is there something that you could say about what you think might be the next thing down the road, that if we have students that are freshmen or sophomores or people that are interested in making a job change, what are some of the trends that you think maybe could pan out in the future?
Yeah, happy to. And you've already hit on a big one with your question earlier. So to answer the second part of your question from before that I kind of kicked the can down the road, it's about simplicity, right? Or I could use a different term, aggregation or consolidation, whatever you want to call it. But you saw that crazy list I put up there, right? We'll bring it up again just to get over the visual. Like, let's say your employer has 8 of these. How on earth are you supposed to figure that out and know which one the right one for the right moment in time is? So patient simplicity, right? How do you create a clean, easy to access front door for all your benefits? So that is a trend that's in process. So there's some companies that are seeking it out. There's names like Quantum or Accolade. You can look those up online. Even groups like Grand Rounds, Castlight, more from the digital side, are going after that. And what they're saying is, look, just call a 1-800 number, just one number, or go to one app or one website, and we will grant you access to your whole world of solutions to help you navigate. And while there's some amazing things out there, it's still fairly early, right? It's just not fully baked yet. The insurance companies themselves are also trying to do that. They recognize that they are kind of the logical source that people come to when they're dealing with health conditions, right? So can they create these types of tools? And they are, either through building their own or buying up organizations to kind of plug into their world, again, to create a single front door. So one of the biggest things that has to improve is just ease of access and simplicity for a member. I call a 1-800 number, I go to one website, I say I'm dealing with this condition or my child is, and then the right things pop up at the right time and allow me to go seek care, always making sure it's up-to-date evidence-based care, making sure it's the highest quality folks, making sure it's the right tools. And while all the pieces, I always kind of think through, like all the puzzle pieces are on the floor and they're ready to go. Someone just has to come and kind of lace it together.
Yeah.
And a lot of groups are trying.
When you go back to that slide, I have another question for you about that. So just imagine that you are a faculty member. You are a new assistant professor at Texas State University, and you have this really great program of research, and you're developing a new sensor that can detect faults, just say. How do we integrate new knowledge that we are creating here at Texas State in health research more quickly and more efficiently into these kinds of companies that have already, moved forward that could use what we are working on?
Yeah, I think it's great. I would say one of two things. I mean, one, obviously, we can identify which organizations might be able to use that particular piece, right? So use your existing example, maybe it's a telemedicine company or maybe it's an insurance company and they want to be able to give a senior citizen some sort of a sensor to help detect a fall that then maybe it triggers a call to the telemedicine or whatever that linkage might be. So I think you can take that technology, seek out these organizations, and see if you can plug that into their world. I would think the funner part would be is then to utilize this whole ecosystem we have here on campus, right? You have business development, you have marketing, you have strategy. You could potentially go incubate, right? And I think a lot of the stuff you talked about makes me excited is create these incubators that come up with something along those lines, develop that, patent that piece, and then all that money is out there just waiting for folks to come up with some unique idea. And I think your challenge there is you become another one of these groups. So where I was going to go next with regards to where the industry is going, a lot of it's going to be aggregation. So kind of what you mentioned is how do we plug in? I think that's what's happening now is all of these groups are having to find ways to come together. So it's not 10 different solutions, it's one solution with 10 different pathways. But I think individual development like that, these folks want nothing more than a slight edge to improve their offering, and their ears wide open. I mean, they need innovation, and they can't do it all from their own development, right? They need outside help, a fresh set of eyes to say, hey, look, this could actually be applied to 9 of these things.
Yeah.
How do we go get plugged in?
Yeah, I always say it's easy to get to Fort Worth if you have a road and a map.
Yeah.
So, Fort Worth's great. These technologies are great, but if we can't access them and we don't know how to use them efficiently within our own care at the moment we need them, then we have no road, no map, and we're not going to Fort Worth and we're not using that stuff.
I think that's right. And I think, I put in, kind of aggregation or consolidation is that what you are seeing now is if I were to show you that list, say 3 years from now, it's going to be a lot cleaner looking, right? People are coming together and merging those technologies together. You know what, maybe a fertility and a maternity company, maybe it makes sense that they're actually one company, right? And maybe it makes sense that the musculoskeletal group partners up with a physical therapy group or through a pharmacy group. Like people are finding alliances. We do this for our own organization. We work with a lot of people who are considering surgery, right? For example. So if you live here in the Central Texas region or in a few other states, you might know a group named Rosti, right? So Rosti based in San Antonio, and they've kind of got a unique way of dealing with these musculoskeletal things. But we actually drive people to a Rosti, and a Rosti drives people back to us. And so we do the same thing. We have a diabetic. Well, we're partners with Livongo. We'll get you to Livongo. And so you're seeing what, I kind of call it the rush to the middle, but we're all now starting to kind of lock arms and figure out how do we make this easy on everybody. And that's got to be part of the future. A couple other quick things. I would say, and this was a little controversial, and this is very much a Brad Nation's opinion, but I'm pretty sure I'm right. This idea of mandatory patient actions, which is really, I realize now, kind of an overly worded sentence there. It's just basically saying, making people do something that's in their best interest before they do something that might be in their worst interest. So I need to have, let's say my back hurts and I go to my primary care physician. They say, oh, I know a great orthopedic surgeon. I go there and now I'm in line for back surgery. Well, what you could have is a mechanism in place to say, look, before you can have that surgery, you need to get a second opinion. Right. And so the idea being just take one quick step back. Just because one doctor says you need to have surgery doesn't mean you need to have surgery. And so maybe you force somebody to get a second opinion first before they do that. And it can be a little controversial, right? You might have an employer going, well, my employees won't stand for this. Or you might have a patient going, hey, I trust my doctor. I don't want to be told what I need to do, even though it might be in my best interest. But more and more I'm seeing employers are adopting solutions like this. We have several within the companies that we work with, and I'm seeing it across a wide variety. And if you think about it, if you're an employer, your employer might be paying 80% of the cost of that surgery. You might be paying 20%. And what if that surgery wasn't even necessary to begin with? Yeah. Or in my scenario, right? Before my wife could have double eye surgery, it wouldn't have been great if we had been forced to get a second opinion, because we probably would have found out that actually was not the right way to go. Mm-hmm. I believe that healthcare in general, people have pulled as many levers as they could pull. And they're going to have to start pulling some bigger ones. And I think asking people to do something in their best interest is something that's going to have to probably come to the forefront. But the really nice thing is, at least from my experience, is the patient satisfaction data is incredibly positive. It's not like it nosedives. It actually stays just about the same. They'll say, well, at first I was mad I had to talk to that other doctor first, but boy, I'm glad I did because they helped me avoid. Or they said, yep, you definitely need that surgery, go get it.
Yeah. I think that could be really helpful, as long as the timeline isn't too short and you don't
Yep.
have to go to Fort Worth with no road,
And
no
that's the
map
key.
to do
It's
it.
gotta be quick, it's gotta be fast,
Yeah,
and especially if someone's in pain.
Think about if your wife didn't have to get eye surgery.
Oh my gosh,
I mean, that's life-changing, you
Yep.
know? I mean, wow, yeah, I agree.
yeah. So a couple of quick ones. I think the data piece will continue it, because I think the things the university like Texas State could do is, identifying areas within data analytics, how can you improve the predictive side of our world so we can actually reach a patient earlier? Are there new and inventive ways you can utilize that data to help people? Like, would Mrs. Smith like to know that she's trending towards something terrible, right? Or, how do you provide better education? How do you utilize data to do that? So this is just going to continue to evolve at a rapid rate because there's always so much money in there. And the last one, I kind of threw this one at the end because I even thought about my own personal situation. I just moved back home to Central Texas a couple years ago, and trying to find a doctor, trying to get access. I need to see a doc. Oh, it's 6 weeks until you can see her. And so what we're seeing is a rise of a lot of doctors opting out of the traditional system, right, with insurance reimbursement, and they're going for a pure, you might hear like fee for service.
Right.
And they're just basically becoming private doctors, right? So I'm no longer taking insurance. And I am going to be here, but you're going to pay me a monthly fee or some type of a pay-as-you-go scenario, but I'm all in from a limit. And I'm going to do a lot of this homework. I'm going to do this research. I'm going to give you the hours you need to make sure your condition is met appropriately. And you're seeing a lot of doctors are opting out of the old world into this, and it creates a divide, right? If you got the money to do it, maybe this is a better option for you, but unfortunately not a lot of folks do. And specialty meds is a big one too. They're starting to actually create medicines specific to your diagnosis, your genomic code, to be able to go through and really tackle things within your specific body. So just a lot of personalization is coming our way as well. And this list could have been 90 things long, but.
So we have to make those kinds of things affordable, and then we have to make them integrated, because if you're paying, for insurance, and then you find out, oh, the person I really want to see is sort of concierge or,
Yep.
fee for service, however you say, you can't afford it.
Yep.
And then all of this becomes absolutely inaccessible to you.
100%. Yeah, and that's where I think it goes very heavily, and some of y'all on the call, if you've heard this term, which is, social determinants of health, which is, a very emerging, field of study, and I know y'all are looking at it as well. And, and it could be something as, I remember one time I was working with the MGM Grand Hotel out in Vegas, and they recognized that their claims data for things like diabetes and things that were, at least type 2, fairly preventable, were through the roof. And so they started doing these studies, and they realized that most of their employees lived in these food deserts. And if you've heard that term before, it's, I live in an area where there's no grocery stores selling me fresh fruit, meats, and things like that. I just live in fast food. So I'm raising my kids, I'm living in fast food. So they actually went and they opened up a free grocery store underneath the casino. So you can go in and actually just get apples and oranges and bananas and take them home to your family, recognizing that. So it's creating food security. It's creating other types. There's on that list, there were some companies that are there to help drive healthy eating habits. But what if you can't afford a healthier food? You can't afford to go to Whole Foods. You don't have a grocery store within 5 miles of your house, but you have 3 McDonald's, right? These are problems we have to figure out a way to solve for at the macro level to make sure that everybody has equal access to these things, and we have a long, long way to go.
I think that forever we thought of healthcare starting when you plug into the healthcare system. But if you do prevention right, and you can use some of these tools and some of these products and companies, then a lot of the healthcare that we used to think of when you get sick becomes irrelevant, because you've actually been able to prevent those things from happening. So moving more, eating right, all the simple stuff that we learn in elementary school. If we do that and do it well, then potentially we can reduce the amount of need that we have at all for doctors.
Absolutely, we can. I mean, there's no doubt about it.
Great. I'm not sure if we have a little bit of time. We can see if we have a question perhaps from the audience.
Go back here.
Maybe if it is a chat.
Oh yeah, there we go. Okay. No questions this time, Nicole says.
Oh, no questions. Well, that's okay, because we can keep talking. So I have some more questions. So I asked you about how we can get some of the things that we're doing at Texas State to be integrated into companies. But I also am interested in how do or do you think, I guess I should say it this way, do you think that there is a space for some kind of organizing system to help us integrate with the market. You know, because you were talking about making things simpler, and the whole idea of the Translational Health Research Center is exactly what you were saying. You know, Texas State's a big place and it's uphill in both directions, and sometimes it's really tough when we're teaching our classes and meeting our students and doing our research to talk to each other and to integrate even within our own campus. So then if you think about sort of going to San Antonio and Austin and all of the places that we could go to find these types of companies and meet with them to integrate our work into what they do, it's a challenge. So is there anything that you can think of that perhaps, you know, if we want to make sure that Texas State is positioned as part of this larger community of innovation in healthcare? Any ideas? I know this is like a big question, but any thoughts you have would be great.
Yeah, well, I like the idea of, you know, kind of like creating a beachhead here, right? So at the end of the day, like to your point, your ability to go out to all these organizations is probably not going to happen, or at least happen efficiently. And they're all going to have different hopes and wishes and dreams for what they want it to be. So I do think it's taking that bold step of kind of creating that here, right? So you create the center here, and then be able to pull them on that side and then customize from their needs. But you're right. I mean, it starts. You know, we had a conversation, you know, recently about it starts at basic levels, you know, like EMRs, like electronic medical records, like even getting doctors to talk to each other. How do you share clinical information? How do you share advancement? Like it takes right now organizations like us to help educate a patient on a treatment pathway. Well, how come they didn't have a single place they could go for that? You know, they can pull that information out. So I do think that the idea of what you're seeking is right, and to be able to have kind of a centralized spot here. And then it's just gonna be a matter of who's your audience to go out there and pull them in, right? Is it companies like what we talked about here today that can feed off of that? Is it employers? Is it insurance companies? Is it the medical community themselves? And I think there's, the answer is probably both and, right? Across all of those things. So my suggestion would be is identify which of these areas you think you really want to target. And then you start building for them, and then you can start expanding beyond that. It's just kind of the boil the ocean thing. It gets very exciting and easy to do that.
Yeah, it's looking for the points where there's, you know, that friction, and thinking, how do we take what we're doing here and then integrating into that? And
the good news is, you know, the leaders of these organizations are not shy. You know, pulling them in, having these conversations. What are your needs? And you know, where are the gaps? And there may be some things that, you know, you start hearing these common themes that you can build around. But I'm excited for what y'all are building here. I think it's going to be fantastic. It's just so cool to see us, you know, evolving like this.
Thank you. And so you and your wife are both Bobcat alums.
Yeah.
Is there one thing, if you could think back to graduation day, is there one thing that you say, wow, I wish I would have known then what I know now about being a Bobcat, or what I gained at this university, maybe not just in my degree, but in the relationships or the experiences that I've had, because I know you were a student body president, right?
I was, yeah.
And so not just inside the classroom, but outside the classroom, how have you sort of leveraged some of the things that you learned here in the long term that you went, wow, I didn't know that was really going to be so important?
Yeah, so, you know, it's funny about the student government thing is, I feel like, especially the first couple of years outside of when I graduated, I went to work, right? And I think this idea that like, oh, all these wonderful things you learn will be directly applied to my first job. And spoiler alert, it's probably not going to happen, right? You have a lot to learn. But the intrinsic things that you picked up along the way while you're walking around campus and getting involved. So the first thing I would say is get involved. The best thing I ever did was get involved. First couple of years I was on campus here, I didn't do anything. I wasn't part of student government, wasn't part of anything at all. Probably by no surprise, right after I met my now wife, suddenly I felt motivated to do something with my life. And so, yeah, I ran for, it was called ASG back then. I think it's just student government now, but I was a senator, then I was vice president, then I was president, and then I had a radio show on KTSW on the morning show, and I was in Student Foundation. And there's nothing extraordinary about me, and there's nothing different other than I just raised my hand and did it. And I feel like what I learned through that, from a leadership perspective, communication perspective, and just the variety of things I got to do, helped me a ton in those first jobs. Maybe, I don't want to say more so than my degree, but because those skills were much more easily transferable than maybe specific. And the only things I would say is, you know, probably two quick things. One is positivity rules the day. It gets very easy to admire a problem and complain and whine. People want to work with positive people. If you can maintain positivity in tough moments. I've been lucky enough to work for a number of startups, and I mean early stage startups when things look like they're about to fall apart. And just positivity and just continue to try to problem solve and continue to move forward is key. And just know it's never gonna be a straight line. I mean, wherever it is you think I'm 47, wherever it is you think you're gonna be at 47, you have no idea. So
That's what makes it fun, right?
it's amazing, yeah. Let the world take you where it's gonna, but yeah.
I cannot thank you enough.
Oh, this is nice.
It's
Thank
such we could talk for 4 more hours, and I really appreciate everyone who's joined us. And I see now we had a couple little questions pop up, and we can follow up on those moving forward, maybe just
Sure.
put some information up online. But thank you so much for joining
Thanks for the
us for
opportunity.
our Big Idea Virtual Day for Translational Health Research Center. And thank you for joining us as well.